Hello, and welcome to the Masterclass series on the state of nursing in Canada. My name is Judy Dukeshire, and I'm the Director of Nursing the Future. In this first session of this series, I'm joined by Dr. Leigh Chapman, the Chief Nursing Officer for Canada. Dr. Chapman is committed to advancing the nursing profession in Canada to ensure equitable access to quality care. As CNO for Canada, she provides strategic advice to Health Canada, plays a convening role on key nursing issues, and represents the federal government at public forums. Leigh is a registered nurse who received her PhD from the University of Toronto's Lawrence S. Bloomberg Faculty of Nursing. And for over the past 20 years, she's gained a deep understanding of nursing by working in both frontline and clinical leadership capacities. In addition to her role as CNO for Canada, Leigh continues to work at a community-based consumption and treatment site in Toronto, where she provides harm reduction services and frontline care.
Thank you so much. Thank you for having me.
Well, it's our pleasure and our privilege to have an opportunity to chat with the Chief Nursing Officer of Canada. So maybe you could start out, Leigh, by sharing with our viewers what the role of the Chief Nursing Officer in Canada is, sort of how it came about and what made you interested in that role.
Well, it is a key policy role. I certainly, I've been very interested in policy throughout my career. And I think, when the position was reinstated in 2022, it was really an exciting moment for Canada because we were, 2 years into a global pandemic and facing major workforce challenges. So that kind of what led to my interest in the position. I was also teaching a master's level health policy course at U of T at the time. And one of my students actually did an analysis of the reinstatement of the role. So this is a role in Canada that has existed since the late 60s. Certainly when I was a nurse, in the early days, I'm still a nurse, when I was a new grad nurse in 2003, there was a whole Office of Nursing Policy in Ottawa, and it was really a policy hub. The role was then eliminated in 2011 under Harper's Deficit Action Reduction Plan and then reinstated over a decade later. So I've been very interested in policy. It's probably been the consistent thread throughout my career, throughout 21 years of nursing thus far. And so that is kind of what led to my interest in the role. So it's a key policy role within Health Canada.
Okay. And I'm going to get to this in more detail later, but is there a major mandate of your office over a certain period of time, or are you evolving as you understand and learn more about the issues?
Well, I would say kind of yes and to that question. Like, I think there is a sort of an agenda for action that I was given when I started in the role, and that has evolved because of the policy landscape changing. But I would say the overall 3 buckets or 3 themes remain the same. So one is about accelerating the integration of internationally educated nurses. So there's various pieces of work on that when it comes to foreign credential recognition or looking at the licensure process or supports that would facilitate that process. And really our role is that of a convener in that work federally, because the work is really done at the jurisdictional level, at the provincial and territorial level. Advancing labor mobility, ensuring that we have a nimble and agile workforce that is able to respond to the needs of people in Canada, and then improving our workforce planning data. So those 3 buckets, IENs, data, and then labor mobility are sort of the 3 themes, but we continue to iterate, on those themes as the policy landscape changes. And I would say, they're very fast moving. Like there's a lot, all levels of government are very seized with the health workforce challenges that we face. And so there's a lot of collective work being done, and we're all sort of driving in the same direction, which is good.
That is good. Absolutely. And, I'm wondering, I know you spent the first year of your role primarily trying to assess the situation. You traveled the country, talking to nurses about nursing and healthcare, the workforce, and their vision of nursing. And I'm wondering if you could talk about what you heard.
So in the fall of 2022, I really made a commitment to visit nurses in every province and territory. And that, and especially to prioritize those at the front line, to meet with students, faculty, and nurses at the point of care, and to prioritize vulnerable populations, those caring for vulnerable populations, which is a very broad definition, including, emergency departments, those in public health, and also those working in the community. So I would say in the fall of 2022, it was that pediatric respiratory surge, on top of the global pandemic, on top of the health workforce challenges. So things were looking very bleak, in the profession at that time. There were a lot of tears. It was a very, very challenging time responding to the acuity that was being seen across the country in the pediatric population. And I would say there was a lot of despair in those early days. But as we continued to drive change, and as my engagement, sort of officially finished, and that I was able to visit every province and territory by January of this year, so it took me about a year and a half. Um, I would say that that despair turned to hope and optimism. And there, we had been, delivering on some work federally in terms of the nursing retention toolkit. So we actually had some, tangible work to show that and so it was an opportunity to say to nurses, we know it's really hard, but we're also working on making a change. And I think it really, was meaningful for nurses, above the Arctic Circle and everywhere else in Canada to be meeting the chief nursing officer, and for them to know that I think of them, that I represent them, that it's all nurses in Canada, regardless of their practice context. And so I think that engagement, and then also the work that we've been doing, has really been, I think, quite tangible. In fact, I can't do the policy work without understanding the landscape. But I also get, I leave very inspired by nurses. Like, I get so much out of it as well, because I'm able to actually bear witness to the excellence in nursing practice that's happening everywhere in the country. So it is, there is this sort of reciprocity that is really wonderful, with the engagement. And I think that to me, it's always inspiring that nurses are willing to come and talk to me, that they're, not just sort of head down, like, we don't really care who's coming to visit. They're always willing to engage. And there's a real sense of hope and optimism that we can turn things around, for the profession, but also for the health of people in Canada. So I think that's been a real shift that I've seen.
Mm. I'm wondering, can we talk a little bit about the despair and the hope?
Mhm.
Can you give me a couple of examples of the issues that are causing the despair, and then maybe some examples of where that hope is coming from?
I mean, I think the despair has been so multifaceted. Nurses, in many units, I've talked to nurses who haven't had vacation for 2 years, and so it just creates this sort of erosion of their professionalism, where they end up calling in sick. Then they feel guilty because it may result in closures, whether it's bed closures or actual ED closures, or and they know their colleagues are working short. They're constantly coming in and working short, and they know that they're unable to deliver the care that they want to deliver. It creates this moral distress then, that they're, not actually providing optimal care, that patients, clients, families boomerang back into the system because they haven't received optimal care. So it really is this sort of vicious cycle. But I think, recognizing that it's not just our professional lives, like, these are our community members that we're caring for, and they're often our families. So we need to also advocate, in terms of the system overall, because uh, you know, we're also recipients of care, not just providers of care. So it really does create this sort of vicious cycle of, despair. And I think, especially because nurses, we always talk about all the unprecedented things that nurses did, during the pandemic, like, doing end of life care with, a married couple, both of them dying of COVID, with a family at the end of an iPad. Like, these are really unfounded things. I spoke to many ICU nurses who said they witnessed more deaths in the first wave of the pandemic than ever in their career. And so it's really hard to actually have the resilience from all that vicarious traumatization. And then if you layer on the workforce challenges, it just becomes almost like an endemic thing in the profession, where nurses just feel such despair. We bring our whole selves to work. It's very hard to separate the personal from the professional. And so, life has been, very hard, 4 years into the pandemic now, and the work has been very hard. But I think nurses are seeing a bit of a sea change happening in terms of, we've had a record investment in healthcare of over $200 billion with the Working Together for Canadians plan last year. All those provinces and territories have now signed bilateral agreements for funding with the federal government. And so there's a lot of work, in terms of affecting positive change, a lot of collective work. We have, Canada Health Act is now 40 years old. It's never included drugs or teeth. And we have a dental care strategy. We have a pharmacare pilot. Like, these are really promising things in terms of modernizing our health systems across the country to better meet the needs of Canadians. We have a retention toolkit. Many nurses say that the toolkit actually reflects things we've been saying in the profession for several years, in fact, decades. But I think it's powerful to have a Government of Canada document that says all of these things that we've been saying in the profession, that these are important tools that we can use to affect change.
Yeah, the retention toolkit is an incredible and comprehensive portfolio of ideas and strategies. So I think, Leigh, it wouldn't surprise you to know that a lot of nurses want to see those changes. They don't just want to hear about them, because we've been talking about these challenges that got sort of tipped over the edge during COVID, but they were there before. So
That's right.
do you have a sense of how the retention tool is being received by institutions? Have people started to implement any of these strategies, and are they measuring the outcomes so that we can all understand it better?
Yeah, absolutely. Many organizations are using the toolkit. So it has created a bit of a buzz, I would say, within the nursing community, and that is transforming organizations. So organizations are using it, for example, with their nursing practice council or their professional practice council, because let's be clear, although this is a resource by and for nurses, it does have broad applicability. I mean, nursing doesn't own the retention challenges. They're very acute in nursing right now, but certainly they transcend to other professions. And so there's broad applicability, I think, to health and social services as well as interprofessionals. So, nurses are using it, or organizations are using it with their professional practice council or nursing practice council as a benchmarking to say, okay, what are we doing well among these 8 themes? Excuse me, what do we need to lean into? What do we need to work on? Where should we prioritize our efforts in strategic planning? I think there's a clear link to quality and safety when we think about retention. Although the recommendations are really aimed at or the initiatives are really aimed at the organizational level, not what the individual nurse must do. It does require investment. So, I think we're seeing, I would say, a kaleidoscope of implementation across the country. Some are doing it at the sort of provincial health authority level. Some are doing it at the organizational level, and then a bit of a combination in other organizations. We've also seen initiatives in the toolkit that we've highlighted being spread and scaled. So, for example, we talk about workplace resources as one of the things nurses want under flexible and balanced ways of working. And we thought it was, well, I certainly thought it was a bit edgy for a Government of Canada document to say we need housing, we need daycare for shift workers, we need transportation and parking subsidies, we need nutrition and rest spaces, like all of these things that other industries have really taken figured out, and something that we're I would say slow to implement or slow to figure out in nursing, or in the health professions in general. And I'm hearing now, we highlighted a couple of jurisdictions that do have daycare available for shift workers. We're seeing more of that being piloted across the country. We're seeing provincial float pools where other, as a means of sort of mitigating spending on agency nursing and travel nursing. So bringing those nurses back into the public sector, to have that flexibility within a provincial health authority. We're seeing that being scaled and spread as well. So, really positive ideas in the toolkit that I think other organizations can emulate, which is, again, I think hope and optimism can be just as contagious as despair can be. And so it's those are the good message stories that we need to latch onto.
Okay, speaking of latching on, because that excites me. I mean, that excites an old bird like me. And I've seen things come and go, and I think a lot of nurses have, which encourages me to ask the question, are you tracking all the things that are happening, and can you share them somehow with the nurses across the country? Because honestly, I didn't know all those things, and not to mention this idea of repeating the wheel, or you know what I'm saying, being redundant in what we're doing without learning what worked about it and what didn't work about it. And is there a way for individuals who have acted on the retention toolkit to share some of their own experiences and help the rest of us?
Yeah, absolutely. So we were very excited to release the executive summary of the toolkit last October for the in-person, face-to-face federal, provincial, territorial health ministers meeting. And they gave essentially us, the Principal Nursing Advisors Task Force. So this is what we call a FPT committee, Federal, Provincial, Territorial Committee. They gave us responsibility for implementing and disseminating the toolkit. So we are now collecting some of those early wins. It's just been over 3 months since we implemented the full toolkit. It was just the themes and the executive summary that we released last October, but the full toolkit was just released in March. So we are starting to collect those early stories, but then also conducting an implementation analysis to actually get more robust data, and more, I would say, sort of longitudinal. Like it will occur over the next this year and next year into 2025 to try to get the more durable impact or not of the retention toolkit. So we are doing that evaluation work or analysis work, as well as trying to get like the early wins so that we can share those stories. And we're, tracking to share them at the fall health ministers meeting this year.
Wonderful. I really want to emphasize, just as a nurse myself in the system, I would love to hear sooner than later, and maybe ongoing, about what's being successful, because that gives you hope. I mean, that alone is hope. Even if it's somewhere else, it's hope that maybe it'll come to you someday. So I thank you so much, Leigh, for that comprehensive toolkit, and I'm so excited that people are enacting some of the recommendations, and I look so forward to hearing more about them, Leigh.
Yeah, we will definitely be sharing all of those examples in the fall, because again, we want them to be, we want to create this buzz. We want to continue to create the buzz. I mean, certainly the retention toolkit is one of the only things I talk about, but we want to share the success stories of other organizations. We know there's great work being done, but I think, have a responsibility to also share the stories. And the examples.
Absolutely. And it also helps to keep the momentum going, because people lose. So often we hear about an initiative or a report or something, and then we don't hear anything. So I think people get a little bit weary, and perhaps wary
Yes.
what's going on because of that. So I'm very excited to hear things, and I know you can't turn that data over night, so I appreciate that, but I do encourage you to share even the smallest amount with everyone, because I know that like this, I think it's going to attract a lot of attention for everyone.
Yeah. That's it. I think we have to recognize that, there's great stuff happening every day in healthcare. And sometimes we get so mired in the doom and gloom stories, but there's really excellent work happening every day. And so this is an opportunity to amplify that from a nursing retention standpoint.
It is, and we thank you, Lee, for doing it. Not that I want to end on a negative note. We're not ending by any means, but I wanted you to give your incredibly it's a dual, like it's like a bird's eye view, but it's like boots on the ground view because you've been with everybody. I'm wondering if you could give us a sense from the perspective of nursing education, research, innovation, leadership. What are the main challenges that we have right now, and perhaps pulling out something that we're doing to mitigate that?
Oh, well, there's so many challenges. I mean, I would say, if I were to summarize it all I mean, I don't want to be, it's hard to be succinct really about all the challenges, but if I were to summarize them all, it's almost as though we are, um, nurses are needing to, nurses currently in the system want something different. They want flexibility. They want um, opportunities for variety in their practice. And I think the system isn't designed for that. The system is designed in this sort of traditional employee model of putting nurses to work. Nurses want autonomy, they want flexibility. And so that's certainly what the education system is grappling with, trying to prepare nurses for an uncertain future. Because healthcare is changing so rapidly. And I mean, hopefully we all break out in hives when we hear like this is the way we've always done things, because we have to be nimble, we have to be responsive and agile. But the education system is struggling with addressing current needs in the system, but also preparing students for an uncertain future. And then those in the system want something different that they're not actually currently getting in most cases in the public sector. So if they want flexibility, they don't get it. They find it in travel nursing and agency nursing. So we have these like really significant sort of push-pull factors. And I think the remedy is really in listening to nurses. So that's the success of the toolkit. I know you've congratulated me, but it was really the result of a collaboration with nurses. And, I'm in this position where I get to amplify nurses' perspectives in my role. And I think that's the beauty of the toolkit, that it reflects what those with boots on the ground have said. And so, but it's also not saying, but thou shalt have a pizza lunch and learn, or do yoga, or have a bubble bath to improve your, personal resilience and commitment to the profession. It's actually about structural change that's needed in terms of how we're valuing nursing work. So everyone has a role to play in that. Researchers, innovators, educators, administrators, everyone has a role in terms of reimagining the way that we are valuing nursing work, really. And how we are being nimble and responsive. When I think of students, we perennially tell students and new grads everything they don't know. And I think that students are really sick of that. They're sick of always being reminded what they don't know, instead of being valued for the gifts that they bring and the insights that they bring to the profession. And I think that is not just congruent with like principles of adult learning, but it is really the way that we need to think about this knowledge-based profession. That if we do really think we have a knowledge-based profession, we have to recognize the knowledge of those in it. And it's not one singular set of ways of knowing, right? It's multiple ways of knowing. And I think that only enriches our practice. and the profession, but it requires, I think, some humility. And nurses are it's very hard when we've practiced in a totally different context than, and nurses of today may face even more opportunities that we faced when we entered into practice. I think that's good for everyone. Instead of bringing people down to, well, thou shalt work 2 years on a med surge floor before you go work in critical care. There's new grads going to critical care now all the time. I went to critical care when I was a new grad 21 years ago, but I was very well supported in an academic hospital. And that's very common now for new grads to be going into these highly specialized areas as entry to practice when they used to be destinations. And I think it's up to all of us to actually think about, like, what do they bring? How does that enrich our practice overall? They may not know certain things, but there's other things that they're very, very skilled at. So I think, yeah, I mean, that was a whole flight of ideas, but I do think, there's this opportunity before us to actually rethink the way that we work, the way we value nursing work, and how that could change now and for the future.
Yeah, when I hear you talking, I'm reminded of how important it is to base what we're doing on evidence, to
That's
base
right.
what we're doing on the research. So for instance, if you understand the experience of the newly graduated nurses cognitively, emotionally, culturally, socially, developmentally, then you are more likely to apply strategies that are safe for patient care, but open up these opportunities for newer or more recent graduates. And I do think that the nursing shortage has been driving some of these changes, and that's not such a bad thing, but just I think I'm encouraging us, and I know that you are on track with this, that we need to do it according to what is the best and safest way of doing it. And I think if there's concerns for people, it's that we bring graduates or internationally educated nurses into the scope of practice that they're not quite ready for, and how do we support them when we do that? Because it's
That's
really,
right.
isn't it, Leigh?
That's it exactly. That these changes are happening, but they need to have supports available. And where it's unsafe is when the supports aren't available. That we're, throwing people into these novel areas without support. So I think, the nursing shortage isn't going away probably in our lifetime. It requires us to rethink nursing practice. And I say this often to folks in acute care, and so far I haven't been heckled out of the room, but that the solutions in acute care, although they're dire, their emergency departments closing, their surgical wait times are lengthy, ALC bed, no bed admits in emergency departments, and the list goes on. But the solutions are actually not in acute care. The solutions are outside the walls of the hospital. And that's actually where we need to shift our focus, our investment, and our efforts, because we will never have enough acute care beds if we keep this perennial focus on acute care. Acute care will always need hospitals, there's no question. And hospitals are expensive to operate. From a human resource perspective and so on. And so, thinking about how we can better invest funding in preventative care, in upstream approaches to lessen the burden on acute care, knowing that we'll still need, people still need their appendix out. Those things will still have to occur in an acute care facility, but just trying to think about how we can actually right-size healthcare across the country.
Oh, I'm excited to hear that, because I don't think the issue is acute care. It's a symptom of the fact that we don't have appropriate preventative and community, preemptive care. And we don't have a place to transition them when they're ready to leave acute care. Not everyone. There are some transition, areas that people have been developing, but it's not it's an exception, not a rule. So yeah, you're right. I absolutely agree. I kept thinking about the programs that we were starting in Saskatchewan when I was managing out there. And one of them was to enhance and increase the interaction of the paramedical services in the community. I know there's some work being done in BC here around getting paramedics to go, so for instance, to assisted living or long-term care, deal with the situation there, if it's dehydration or whatever it is, so that that individual can stay in their home or in their living situation without having to be hospitalized. Those are the things that can take the weight off all of these admissions, particularly emerge that sit in hallways for, sometimes a week.
Absolutely. And I think there's ample work for everyone in today's healthcare environment. And when we think of the nursing shortage, sometimes the solution to the nursing issues on a particular unit or in a particular facility, the solutions may be bringing in paramedics, bringing in, pharmacists, pharmacy techs, OT, PT, and PSWs and healthcare aides. Sometimes reducing that admin burden for nurses is actually bringing in other providers. And so really thinking, and to your point around, keeping people out of hospital and managing those things outside of hospital, thinking of the role nurse practitioners can play as well, across the country when it comes to primary care delivery, and especially those people in Canada who are unattached to primary care. There's a real role for nurse practitioners in that context. So yeah, there's ample work for, there's no shortage of work in healthcare. And I hope that, that can also play into recruitment strategies that we need for all health professions across the country as well.
Absolutely. Well, it's been an incredible dialogue. I think that we have a really good sense now in the first of our series on what you're doing in the Chief Nursing Office, sort of how that's translating to what institutions and health regions are doing across the country, and looking forward to hearing more about that. So I wonder, Leigh, if you could just end with where you see all of this going as we anticipate, the next 5 years or so.
Oh my goodness, just as you asked that question, the light like shone in through my skylight. It's like the crystal ball is is manifesting here in my office. I think that one of the things, maybe I'll answer that question with a question I sometimes get, which I really like, is what keeps you up at night? Sort of like, what's the worry? And then the ask for nurses. And I think the worry is the lack of unity, that we are a bit of a dog's breakfast as a profession across the country. There's essentially 13 different health systems, 10 provinces, 3 territories. In fact, you could say 14 health systems if you count the federal government, which employs many healthcare providers. 2 official languages, 4 different categories of nurse across the country, and then all the areas of specialization. And, I know the divisions, right? Like I used to work in acute care, I now work in the community. And there's always a finger pointing that happens instead of just recognizing the common thread of nursing that actually unites us across the country and globally. And I think that that's where we find our power as a profession. So we need to be united. We need, we may disagree in rooms, in conferences and in events, but when we're speaking publicly as a collective, we need to be united. And that is, from the nursing student, and it's not to say we don't have different ideas. We absolutely do. But I think that we need to be united professionally. And that unity is where we find our strength. So I think, where nursing is going, I think it's incredibly optimistic. We still have interest and applicants in nursing education programs. We still have, students who are really excited to graduate and enter into practice. And yes, they're just as fixated as you and I were with how do they catheterize or how do they insert an IV. And and those are things that, you figure out in your practice, and that you become very skilled at these things. So they're less worrisome. I think it's the engagement of the profession across the country and the need for unity. Nurses are so good at advocating for patients and clients and families at the point of care. And sometimes they forget to advocate for themselves and their colleagues. And then thinking about how that advocacy can actually transcend from the patient care, the therapeutic patient client, nurse client relationship to changing things within the organization or outside of the walls of the organization. And, there's nurses across the country doing amazing, amazing work that are, they're passionate, they're engaged in their communities. We just need to amplify that professional perspective because it is, nurses are often the most trusted healthcare provider, and we're the most numerous. We're the largest group of regulated health professionals in Canada. But we also are most proximal to the point of care. We have this very broad systems perspective. And so that is really important in transforming societies, in transforming, the world, really. And we don't think of that. We don't think of our ability to make a difference, to actually change things societally. But I think nursing has a huge role to play in that. ICN this year, they're really talking about the economic power of nursing. And it really is about that importance of changing communities and that investment in nursing resources is an investment in society. So really thinking about that legacy impact that we can have as a profession. And I think we only get there professionally as nurses in Canada if we stay together, if we stick together and are united.
Absolutely. I'm excited to think that Nursing the Future and other organizations, CFNU, CNA, CAS, and et cetera, and many more, are potential platforms for that unification. And being,
Absolutely.
and being able to, I think part of the unification is understanding what other people are doing and what are their successes and what are their challenges and how can we work together. So it's exciting to hear you talk about unity the way that you do. And I do think that the chief nursing office can provide some of that unity moving across the country. So we're grateful to have you, Leigh. I know we're going to be chatting again at the very end of this series, and I very much look forward to that as well. Any final thoughts?
Well, I want to thank you, Judy, for nursing the future. I, was dialed into the work that you're doing and in fact attended a Nursing the Future conference at one point, years and years and years ago. And I've held on, as you saw, I showed you previously my little coil bound Nursing the Future book. It's, probably one of the OG editions, but you've been at this for so long in supporting that transition to practice. And it's such an important contribution to nursing in Canada and internationally. So I really want to thank you for your work, your program of research, your lifelong work and commitment to this work, but then also for this series, for having the conversation and amplifying nursing excellence and all the innovation that's happening across the country. So thank you.
Well, that's humbling. I also wanted to say that it's exciting to be able to get the kind of receptive, open, welcoming embrace from people every time I ask them if they would come and talk about something. So I do think that part of the unification is your willingness, and everyone else who's in this masterclass series to come on and chat about it and have that opinion and narrative out there. So thank you, Leigh. I look forward to the rest of the series and our final session together.
Excellent. Thank you so much.